It is August 2nd, 2021, and I am heading to San Francisco today to get my pre um, kidney transplant evaluation. Now, that does not mean that I'm getting a kidney, so I'm going through their whole list of evaluations they need in order to put me on their list for kidney transplant. Now, their list is the CPMC kidney transplant list, and I'm going to do everything they need me to do there to see if they can put me on their list. So this is where I'm going today, the Van Ness campus in San Francisco, the CPMC medical office. So once I do all of their evaluations and speak to their specialists, then we're going to see what they say about putting me on the kidney transplant list for CPMC.
I wonder if there's a place close to here to go and get something to eat after we get out of here. If we're not broke.
Hey, Porter?
Yes.
How you doing, Dr. Patel?
How are you?
I'm doing okay.
We met by video.
I don't remember.
I do remember.
Right.
Alright. Your first time here, right?
Yes, at this campus, yes.
Yeah.
Okay, good. Alright, so it looks like we put you on the waiting list based on that video visit for a transplant.
Okay.
Yeah.
Now I'm familiar with the UC Davis process, so they had me on the inactive list.
UC Davis?
Yeah, UC Davis. So they just recently put me on the active list. So with CPMC, I'm not really sure like what's.
Why'd they have you inactive?
Because they needed a angiocardiogram.
You did that?
Yes, I did.
When was that done?
I don't know. It was done a couple of months ago.
So now you're active with them?
Yes.
Now you're on our list inactive right now, but the reason you're here is to make you active.
Right.
That's probably we brought you here. I didn't know you had a cardiac cath. Was it fine?
Yeah. Everything came back. When I spoke to the coordinator,
Mhm.
they got the results of it.
Yeah. Yeah. They put any stents in or anything?
No.
Okay. Yeah, I'm not sure what required that, but it looks like they did that.
So
So
obviously get the records.
on that, okay.
Yeah, you have 1 year and 3 months on our waiting list. Okay. Because your time starts when you start dialysis. Right. Your blood type is O.
Mm-hmm. Was it O negative?
I don't know about that part.
Oh.
It's not relevant for us.
Okay.
And you have diabetes, right?
Yes, I do.
And the diabetes in the kidney too, right?
I don't know about diabetes in the kidney. That's not what caused me to have kidney disease.
I thought you had a biopsy that showed
Kidney disease, diabetes in the kidney.
It's possible. I mean, I don't know. Like, that's not what I thought, like, I was fine before. Like, I struggled with diabetes and high blood pressure.
Yeah. You've been
But-
diabetic since age 18, right?
Right.
Yeah, it looks like you have a biopsy apparently that showed diabetes in the kidney.
Okay.
Yeah.
But, then I got an autoimmune disease. I got sick,
Yeah.
chemo, all
Yeah.
that stuff.
Right.
So I'm sure that exacerbated the thing.
That's correct.
Yeah, but it wasn't like the direct root.
Yeah. And you started peritoneal dialysis in April 2020, right?
Yeah.
You still doing that, peritoneal?
No.
Oh, you switched?
Mm-hmm. Switched to chemo.
When did you switch to chemo?
I can't even remember when. It
This
was,
year?
No, not this year. It was I think last year.
Well, last year you started dialysis, but yeah, I guess
The end of last year.
Yeah, I wasn't even on chemo. I wasn't on PE for that long.
Oh,
I was only
on PD for like a cup of coffee.
Okay. Okay. And you have a fistula then for dialysis?
Yeah, graft.
Left arm graft?
Mm-hmm.
Okay. You still have the porta cath for chemo?
Yes, I do.
Where's that?
Right
chest?
Yeah, right chest.
Any other surgeries?
I mean, aside from the standard stuff,
Like what?
biopsies.
No, it's actual surgeries. How about gallbladder, appendix, tonsils? I think we got them all. Just the graft in your arm and then the PD catheter.
Yeah, which has been removed.
Right. So those are the only two surgeries you've had, it looks like. Are you on treatment for diabetes right now?
No.
Nothing?
Mm-hmm.
You were on insulin before, right?
I was.
And no treatment for like 3 years?
No treatment, no.
For like 3 years?
Mm-hmm. Maybe 2.
Oh, 2, okay. Any eye problems with diabetes? Any laser surgery in your eyes? Never? How about neuropathy, numbness or tingling in your legs, feet?
Mm-hmm.
No? Okay. You said, and no heart attack or stroke, right? Do you have sleep apnea? No, okay. And yeah, you had that HLH back in March of 2018, right?
Yeah.
Are you still following with the oncologist?
Yes, I am. I speak with her regularly.
You do?
I'm speaking to her this month, at the end of this month.
Got it. Okay. And so how you doing overall?
Aside from dialysis, I mean, I guess I'm doing as best as I can.
Right. How's dialysis going?
It's going fine. I mean, medically, I'm fine.
Yeah.
Yeah. But it's dialysis,
Yeah.
it's
How
terrible.
many hours are you doing it?
4.
What's your dry weight?
Dry weight's usually 100.1 kilos.
You make urine?
Yes, I do.
A little bit or a decent amount?
Kind of. It depends. It just really depends. Sometimes a little bit, sometimes a lot.
Okay. And you're pretty active in your life? You do some walking?
I do martial arts.
Yeah,
And some exercises. Light. Lightweight lifting.
Yeah.
Some yoga, stretching.
You get chest pain?
No, not
Shortness of breath?
No, not.
No.
When you say shortness of breath, you mean just like out of nowhere?
No, when you're doing walking or something, you're walking.
Yeah, but that's due to I had more stamina and energy before I got sick.
Yeah.
So I mean, all of the symptoms are due to me being on dialysis.
Yeah. Do you smoke?
No.
How's your appetite?
It's okay. Sometimes sometimes no. It just really depends.
Is your weight stable?
Yeah, relatively. I mean, I lost a ton of weight when I started on dialysis.
Mm-hmm.
Like, I think the heaviest I was like 265.
You have sleep apnea?
No.
Okay. And do you check your sugars or not anymore?
I used to, but my sugars are pretty much in normal range since
Okay.
being on dialysis.
Have you had the coronavirus vaccine?
Yes, I have.
Any chronic fevers?
No.
Headaches?
No.
Any hearing problems?
Mm-mm.
Vision? Your eyes are pretty good?
Yeah, my vision's okay. Blood vessel broke in my eye.
From the diabetes?
I don't know what,
Yeah.
probably from blood pressure maybe.
Yeah.
But I haven't had, in like 3 years, I haven't had any issues with diabetes.
Okay. Any
So,
chronic cough?
no.
Any swelling in your legs?
No.
Joint pains, rashes? Any prostate problems?
No.
You said no heart attack or stroke, right?
No.
Any blood clots?
No.
Liver problems?
Mm-mm.
Hepatitis?
No.
Seizures?
Mm-mm.
Tuberculosis? Depression?
Not clinically, no.
Any cancer?
No. Not clinically.
Besides, well, HLH just, I'm not sure it's typically a cancer. Right? Okay. Any thyroid problems? Stomach ulcers? Pancreas problems?
No. Though.
Pancreatitis?
No pancreatitis.
Okay.
But I remember a long time ago, I got evaluated and there might have been like some sort of like not a hole, but maybe like a fissure or something in the pancreas.
Really?
But it wasn't like, a big enough of a problem for, the doctors at the time to really do anything about it.
Okay. Okay. And do you have any donors, Carl?
No, I don't.
Where do you live, Carl?
Fairfield.
Who do you live with?
My mother.
Just the two of you?
Yeah, just.
She's 61 or 62?
She's 63. My mom would like to be a donor, but she's I'm not interested in taking her kidney.
Okay.
And she also had cancer.
What kind?
Breast cancer, stage 3 breast cancer.
Yeah.
So I don't even know if that would even disqualify her from.
Yeah.
So would it? Or would
It would.
Yeah. Okay.
It
So
would.
she's not even eligible
Yeah.
candidate. So other than her, then I have nobody else. No.
Gotcha. Okay. All right. And are you still working?
No, I'm not.
You work at a sporting goods company?
I did. That was the last job I had.
No smoking, no drinking,
No.
no kids.
No kids.
And then it's like your mother had breast cancer. Was that recent?
No, this was I think 15 years ago. I think.
Your dad, no contact.
No contact.
And you have a sister, no contact.
I do, but I talk to her from time to time.
Oh, really?
Not really, no.
That lipid sore is new.
Yes, it is.
What were your symptoms when you had the HLH?
Lymph nodes and stuff.
No
Fever?
no lymph nodes. Fever. Just I was just really sick. It started off with extreme exhaustion,
Mm-hmm.
muscle pain.
Mm-hmm. Mm-hmm.
What else? What other symptoms? Just overall, just overall sickness.
Mm-hmm. Were you in the hospital?
I was for 30 days, so for about a month.
You in ICU and stuff?
Yeah. So, and they started me on emergency chemotherapy and steroids, immediately when they found out what it was.
Yeah.
So
It probably took a while to figure out something, I guess.
Sorry?
I'm guessing it took them a while to figure it out.
Yeah, it took them a while.
Rare.
Yeah, it took them a while to figure it out because they were wondering if I had maybe a HIV.
Right.
They were asking me that. They were wondering if I had some sort of cancer.
Right.
And the consultant, the oncologist consultant, on call, they consulted her.
Right.
And after her evaluation, they said that based off of what the symptoms are,
Right.
I think it's this.
Right.
So they ran the test and to find out it was HLH.
Yeah.
So the kidney disease, me being on dialysis, and the kidney disease wasn't just from me just being just irresponsible and just just not taking care of myself. I struggled with diabetes for a long time, but it wasn't like it wasn't like a thing where I just left it and I was just like, oh well, forget it. I'm just gonna no, I did struggle with it.
Yeah.
And I tried to, maintain a healthy lifestyle as much as I could.
Right.
But
Okay.
me being on dialysis is not. I mean, hey, it says that I'm here because of diabetes, and so who am I to argue? But I know that the chemo and the steroids and all the stuff that I had to take, I'm sure that exacerbated the
That's
situation. It just accelerated it
That's right.
way faster than it would have been if I didn't get it.
That's right. Okay. Yeah. So we think you're a good candidate for a transplant. We wanted to just check you out in real life today, so that's why we brought you in. Like I said, we saw you by video. But like I said, I agree. And back then when I saw you, I thought you were a good candidate. That's why we put you on the list. So I think we'll get the records from that cardiac cath that you had at UC Davis a couple months ago, and then I'll look at that. And once we get that, we can probably move you to active on the list, just like UC Davis. Your blood type is O. Okay, I mentioned that to you earlier.
Right, and that's for
Longest
blood.
wait time.
Yeah, that's what they told me.
So you'll be active on the list, and then so you might be wondering one day, what's going on? I'm active on the list. How come no one's called me for a transplant? And the answer to that question is that the waiting time issue. You don't have enough waiting time, and so if you're ever wondering why we're not calling you, that's the answer. So that's why we always tell all the patients, the best way to get a kidney transplant is always a living donor. They work right away. They last much longer. You don't have to wait anymore. And obviously you don't have a donor right now, but if that should change, that's really the best thing for you. And the way that works is the donor has to call us. We don't call them. They have to go on the internet, fill out a questionnaire to start that process. Do you have that information, or would you like that?
I do. I think I have the.
Yeah.
I got a brochure
Yeah.
here.
So that brochure has a website where if you have a donor, that's the website they have to go on, and that's how the process will get started.
Any questions about that?
No, I don't. You know, like I don't think I'll.
Yeah,
find
just in
anybody.
case, you never know. Yeah, just good to keep it around though. Anyway, so when you get a transplant, there are risks and benefits. There's risks from the surgery, like bleeding, infection, problem with the anesthesia, heart attack, stroke. These things are not common, but they are risks. Your
I
heart
read that in the.
Yeah, your heart's obviously in good shape, so it should be a big problem there. Also, your body will reject the kidney. That happens to everyone, so you got to take medication to prevent that. You got to take these for the rest of your life. All the transplant patients are higher risk for infection, certain kinds of cancers. People get your diabetes could come back. You're gonna end up on insulin again. You could have bone problems. These things also sound really bad, but not a major problem for most patients. And the benefit of the transplant, most people do have better quality of life, so no more dialysis, people have more energy, they can travel, eat more foods, and also most people will live longer with a transplant compared to being on long-term dialysis. That's kind of where right now with everything, Carl. We're gonna get the records and draw your blood, and then we'll get you active on the list. And then if there's any changes in your health, obviously let us know about it. Any contact information, illnesses, just keep us in the loop. Okay. Good. All right. Anything else? Anything else I can help you with?
No. I mean, that's pretty much everything. It's just, just the wait time. So.
Yeah. Who's going to help you out after the surgery?
My mother.
Did she drive?
Yeah.
Is she here today?
Yeah, she's here. She's out now. She's out.
Did she want to join us or?
No. She's fine. She's fine sitting in there.
You sure? Okay.
Yeah. And I can explain it to her. I can explain it to her.
That's fine. All right. Anything else I can help you with?
No, actually, you know what? I did want to ask you. When I got the packet, they were talking about a program about like how they were like reevaluating the program in order to like be able to get patients like me who have like a long wait time due to my my blood type a kidney faster by not necessarily like a living donor but a deceased donor. Do you know what I'm talking about? Like the KDPI or?
Well, yeah, that's one. Okay, that's one area. Yeah, it's KDPIs. Basically, those are kidneys that are from older donors typically. So these are people older than 60, or they may be, let's say, older than 55 and have diabetes or high blood pressure or some other issues. So that's a separate list. So there's less people willing to accept that type of kidney because it's from an older person, and so the wait time is shorter. So instead of 8 to 10 years, and maybe 5 to 7 or so, 5 to 6 years. So it cuts the wait time down a bit. The disadvantage is that they don't last as long on average. Those types of kidneys.
So those kidneys also have like, come with like prerequisite diseases with them, like hepatitis C.
No, that's a different category. So yeah, but those kidneys may have a little bit of diabetes in them or high blood pressure.
So would that negatively affect me if I got them?
Yeah, I mean, it wouldn't give you diabetes necessarily, but it may reduce the long-term functioning of that kidney because it has some damage, let's say, to it. That's why I said earlier they don't work as long on average.
Okay, so on average, what are we talking about here?
I mean, I don't know, 5 years, let's say.
5 years?
Yeah, compared to a living donor, maybe average about 15 to 20 years.
So I would still be, so even if I got that, like that damaged kidney, like I'd still be on the list. Like you wouldn't just be like, oh well, he got a kidney, and just take him off the list.
Well, no, once you get a kidney, you go off the list.
Okay, so
you have
then
to get back on. If you need dialysis, you're saying if you go back to dialysis, is what you mean?
Like if I got the damaged kidney, it's working for about 5 years, so I'm still not accumulating any more time.
No, you start over. You start at time 0.
Okay, so in your estimation, it's probably not even worth it.
I would probably hold off. Yeah, that's a tough call.
Because it's either
if you're older, I would say definitely do it.
So it's either wait like 100 years to get a kidney, or just get some spare tired kidney, have that fail, and then
every kidney fails eventually.
Yeah,
every kidney fails.
Yeah, but like the amount of time it takes is significantly much longer.
Correct.
For a fresh kidney as opposed to a pre-damaged kidney.
The counterpoint to that, though, is that it would get you a transplant sooner. So that's the counterpoint to that. So You know, I know you're looking at it from, oh, I got a trash kidney, but the counterpoint is that you'll get one sooner, so there's a balance there.
And it's not even that much. It's not like the time is not even that significantly sooner.
Yeah, I mean, it's a few years. It's a few years.
So the best thing to do is
And the
really
other thing
just.
is, you could possibly get a kidney from a hepatitis C positive donor.
Yes, I'm not even trying to entertain the idea of that.
You're not?
I can understand that they could cure it, but like I'm not even like I already have enough stuff going on.
Okay.
You know
That actually makes more sense than the other one, what we just talked about.
what getting hepatitis C?
Yeah.
I prefer not. I already have an autoimmune disease that like I still have. Like I never got a bone marrow transplant or anything like that. It's in remission, but like I still have it. I'm still at risk. It can still come back. Not to say that
Okay.
hepatitis C will affect that,
Right.
but like I just don't want anything else. Like I think I've had enough.
Okay.
You know.
All right, anything else then?
No. That's
Okay.
pretty much it.
All right, good to see you, and we'll get you moving forward, okay? On the list. Take care.
All right.
Thank you. And then you'll see a surgeon and I believe a social worker today as well.
Okay. I think the nurse was telling me that the social worker was working from home today.
Oh, they may call you then.
Yeah.
Yeah. All right, thank you.
Mm-hmm.